Neck pain and lower back pain are some of the most common complaints body therapists have to deal with. And yet many body therapists does not know about a very important structure that has a lot of influence on this complaint. And because of that, they sometimes have a hard time really solving their patient problems. My name is Oren Dotan and I'm an osteopath. And today I'm going to share with you something that many body therapists overlook: the Galea aponeurosa. The Galea aponeurosa is a dense fibrous tissue that is attached from the frontalis muscle into the occipitalis muscle. Okay? So let's see now how the Galea aponeurosa can affect headaches, migraine, neck injury, and so on. The first connection is through the emissary vein. The emissary vein are veins that lie underneath the Galea aponeurosa. They connect the extracranial venous system with the intracranial venous system. They connect the inside of the skull to the outside of the skull. When the Galea aponeurosa is contracted, this can create a blockage in the blood flow in the area of the head, and thus create migraine, headache, and neck complaint. Also, the tension through the Galea aponeurosa can transmit through the emissary vein to the dura mater, and thus again create a neck dysfunction. The Galea aponeurosa is also the first layer in the cranial system. So for all the therapists who work with the cranial system, it's also very important. In the cranial system, we have 5 different layers: the muscular layer, the bone level, the dura, the fluid, and the brain. Each of those elements require a different treatment. And if the Galea aponeurosa is contracted, it can affect the function of the whole cranial system. So the first step in my method is always diagnosis. We have 2 ways to diagnose the Galea aponeurosa. The first way is to press here at the supraorbital foramen. Here we have a nerve that's called the supraorbital nerve, and this nerve is the nerve that innervates the Galea aponeurosa. Every time you're going to have a dysfunction in the Galea aponeurosa, this place is going to be painful. Many times, people with headaches or migraine intuitively press this place here because they feel it's relieved their pain. What they are actually doing, they are inhibiting this nerve, and that releases the Galea aponeurosa. This creates a much better flow of venous blood in the cranial area. The second way to diagnose the Galea aponeurosa is something that I developed. So listen carefully, I will guide you through this step by step. So first, you're going to put the hand, the upper hand, you're going to put on the frontalis area here. The lower hand, you're going to put on the occipital area. Now, what is very important is that your touch will be very light. When you're touching the area of the skull, you should not feel the bone structure. You only feel the muscle. If you're pressing too hard, you're going to feel the bone, and then you are in the wrong layers. So again, you have to press very light so you won't feel the bone level. So what I'm going to do now, I'm going to fixate the lower hand, and with my upper hand, I'm going to pull the frontalis in this way, and thus create a stretch. And then all the force is going to transmit down to my lower hand. So I put my hand like this, and with my upper hand, I'm sliding into inferior direction, and I assess how the tension came to the hand that is on the occiput. And then I'm going to do the opposite. I'm going to fixate the hand, the upper hand on the frontal, and then I'm going to pull the occiput in an inferior direction like this. And then I'm going to assess how the tension is moving through the occipitalis into the frontalis. This is the test for the diagnosis. Now, we're going to have 3 different options in this test. First, when the pressure, the tension cannot pass from the frontalis to the occipitalis, and then the tension cannot pass from the occipitalis to the frontalis, this is give you the indication that the problem is in the galla aponeurosa. This is option 1. Option 2 now. Listen carefully. I'm going again to pull the frontalis in inferior direction, and the pressure, the tension is not coming to the lower hand on the occiput. But when I'm going to move the occipitalis into inferior direction, the tension comes to the frontalis. And this shows that you have a blockage somewhere over here. And then what I'm going to do, I'm going to check the coronal suture, the fronto-sphenoid suture, and the nasofrontal suture. And after I will check this and treat this area, I'm going to retest what we just did. Now, the third option is that I'm going to, again, to pull the frontalis in a few direction, and the tension is going to the occipitalis. But when I'm going to push the occipitalis, the tension doesn't go. Doesn't go through, doesn't transmit into the frontalis. And then what I'm going to check is 3 structure. First is the upper cervical, C1 and C2. Second is the occipitomastoid suture. And the last is the lambdoid suture over here. After I treated this structure, I'm going to do the test again. This is one of the ways I do my cranial diagnosis. In this video, I will show you how to release the galla aponeurosa. But before that, I will show you one more diagnosis that I'm incorporating in my practice. The galla aponeurosa is a part of a fascial chain that starts in the plantar fascia, go to the calf muscle, hamstring, erector spine, and in the end is finishing here in the galla aponeurosa. This is called the superficial back line according to Tom Myers. Before the actual technique, I'm going to ask my patient to lift his leg and to see the range of movement and how much tension the patient has in the area of the hamstring. Then I'm going to release the galla aponeurosa in the technique that I'm going to show you, and then I'm going to reassess this test. I'm going to ask him again to lift his leg and to see if the range of movement have changed and if the tension in the hamstring have changed. So now I'm going to show you the technique. So in this technique, what I'm going to do, I'm going to use a technique, an approach that's called indirect. Instead of stretching the galla aponeurosa, what I'm going to do, I'm going to close it. So I put my hand again in the right position. As I told you before, one hand on the frontalis. So let's say the problem is on the left, and one is on the right. And now what I'm going to do, I'm going to close them together. So I put my hand like this, and I'm going to bring them together until I feel the tension is meeting in the middle. And at this point, I wait. I wait for around 90 seconds. And then around 90 seconds, you will see that the tissue is starting to melt. You feel like the tissue is want to open. And then you just follow this movement. You need to recognize this point when you have this melting sensation in your fingers. And then after this, I'm going to do the same test again. I'm going to put my hand here. I'm going to transmit first from the frontalis to the occipitalis and see if the tension transfer. And then I'm going to pull the occipitalis inferior and see how the tension is going to the frontalis. If I succeeded, the tension needs to go in an equal way. The second way for me to verify that I succeeded in releasing the galla aponeurosa is by pressing again this area over here, the supraorbital fissura. And you'll see that after you are able to release the galla aponeurosa, this place will not be painful. In the beginning of your test, you'll see that this place is going to be very painful. And after this technique, if you have done it in a successful way, you see that all the pain disappears. This gives you the indication that you were successful. This is an objective way for you to know that you were successful in your treatment. So when we are going to release the galla aponeurosa, it's releasing all the back superficial line. And this is what's going to release the lower back. This is one of the connections that the cranial have with the rest of the body and especially the lumbar area. So you see how lower back pain can originate from this place, from the galla aponeurosa. So what you have seen in this video is a demonstration of a method that I have developed through my clinical experience. This method consists of a process of 3 parts. The first is an objective test, the second is a technique, and the third is a retest to see the effect of your treatment. This way you always can know if your treatment was successful and if your therapeutic strategy was correct. Because the technique is very gentle, the retest will give you the confidence that you really made a change in the body. As you have seen, this method combines craniosacral with other modality of treatment. In this case, it's Meyer's fascial chain. But in other cases, we are going to integrate other theory, like Little John, Zinc, Janda, Chapman reflex point, and a lot of other theory that are related to the cranial system. This combination gives us a much better understanding how the body works as one unit. These are the things that body therapists usually don't know about, but they are the things that make a difference between a good enough body practitioner and an extraordinary body practitioner. Knowing and understanding the different connections inside the body is crucial for making you able to really heal your patient and to be the best therapist that you can. If you are curious to know more about the Intergative Cranio foundation course, let's talk. Press this link to schedule a session with me where you can ask any question you have about the course and see if you're ready to dive deeper into the healing of the body. Thank you very much.